Hi everyone, and welcome to this afternoon's Lymphoma Australia Patient Education webinar. My name's Emma and I'm one of the nurses at Lymphoma Australia, and I'll be your host for this afternoon. In the spirit of reconciliation, Lymphoma Australia acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. I'll start with some quick housekeeping. If you do have any questions throughout the webinar, please put them into the Q&A function at the bottom of your screen. We'll have a small amount of time at the end of the session to answer some of them. There is also a chat function. However, this won't be monitored for any questions, so please use the Q&A section if you do have a question. If you miss any of the webinar today, please don't worry. The webinar is being recorded and will be uploaded to our YouTube and Spotify channels within the next few days, and a link will also be emailed to you. We've held quite a few patient webinars this year, and today is part one of a three-part mini-series on supporting families. Part two will be on the topic supporting the partner and carer. Part three will also be talking to children and young people about your lymphoma. And you can register for these webinars via our events calendar. For anyone who isn't aware, we also hold regular online support groups via Zoom and some in person. We've just recently added multiple new group dates, both online and in person, up until the end of the year. So you can register for those also through our events calendar. I'll put a link to our events calendar in the chat section, so you can go onto our events calendar and see what's coming up. Okay, on to today's webinar, which is on the topic working and lymphoma, and presented by the Occupational Therapy team at Selsus, Andrew Smith and Dr. Amy Wallis. Mr. Andrew Smith has worked as an occupational therapist in the cancer sector for the past 19 years. His clinical career has included senior roles in the acute, primary care and non-for-profit cancer sectors, alongside work in program development, research, quality experience, leadership and innovation. He has worked in some of the country's leading cancer organisations, including the Peter MacCallum Cancer Centre, the Australian Cancer Survivorship Centre, Olivia Newton-John Cancer Centre, Victorian Tasmanian Youth Cancer Service, Leukaemia Foundation of Australia and Breast Cancer Network Australia. He has published in peer-reviewed journals on the topics of occupational therapy and cancer, adolescent and young adult cancer survivorship, psycho-oncology and cancer survivorship. His interest areas are helping people live their best lives with and beyond cancer, blood cancer, breast cancer, youth cancer, cancer-related fatigue and cancer and employment. Dr. Amy Wallis is an occupational therapist with extensive experience as a clinician and academic spanning over 19 years. Amy has worked in both the private and corporate sectors and tertiary education settings in the areas of chronic condition management, pain management, rehabilitation, neuromuscular conditions. She currently works as a university academic, teaching and researching in occupational therapy in Western Australia. Amy's research interests include qualitative methodology, occupational therapy in cancer care, survivorship care, and return to work for people living with cancer. Amy is published in multiple peer-reviewed journals and has been a reviewer for multiple peer-reviewed journals. Amy has also completed her PhD exploring the adolescent and young adults' experience of living with cancer from an occupational perspective. Thank you, Amy and Andrew.
Thank you for the introduction. I'm just going to screen share our slides, so hopefully they will come up for us. So I might just get you to sort of let us know that they're up and going.
Up and running?
Yep, we can see them.
All right. So let's get started. So today, obviously, we were asked to speak about employment and return to work for people living with lymphoma. So we are going to run through a couple of things before we get started. In terms, we'll just add our own little bits of housekeeping quickly. if we had turned the camera on, but we obviously, you guys don't need to do that in this situation, so just ignore that one. As Emma said, if you've got any questions, pop them into the chat and we'll come back to those at the end. Feel free at the end to sort of add any questions and comments that you feel relevant to anything that we've said, but also anything that we might have missed that's a burning question for you guys as well. We're really happy to answer anything additional and see if we can assist you with anything else that we might have missed. So today, what we're going to have a little chat about is sort of who are we, which Emma sort of introduced us as separate entities. So we'll have a little bit of a chat about who we are together as Selsus. Then we're going to have a look at the impact of living with cancer and return to work and lymphoma, and what does that mean in terms of employment? What are some of the challenges? Emma actually sent us through some questions that were pertinent to people who sort of asked some questions prior to this session. So the way we've set it up is we've set it up in terms of those questions. So each of those slides will address the questions that were sort of preempted prior to this session, and we'll add some additional information to those as well. Then we'll obviously have a look at some questions if you guys have got any, and we've got some details at the end about our services in terms of contact details and how to get hold of us post-session if you wish to. So we've kind of been introduced, so I won't go over too much of that again, but that's obviously myself and Andrew, and when together we make up the team at Selsus. The team at Selsus, we're occupational therapists, and as you can see, we've got over 45 years combined experience, and we have a range of experiences from clinical work to research and to education. So Andrew and I joined forces a number of years ago in not Selsus, but in another company where we were working in cancer education for health professionals. And since then, as you can see, in 2021, we established Selsus. And Selsus is a dedicated cancer support and rehab telehealth service. So we work with people who are living with cancer at all stages of the disease trajectory, and helping them to really function and to live well and to participate in their daily life. So we work with people who are impacted by potentially fatigue, cognitive issues. Return to work is obviously a big part of what we do as well. And anything that really impacts people's life post-cancer, to be able to return to doing the things they want to do and need to do. So we run a telehealth service. It's Australia-wide, and we also have another component of Selsus, which is our education and professional services for allied health professionals working in the area. So through that, we run workshops and mentoring programs, but we also research in the space of cancer care as well. So we both have a particular interest in return to work and employment, and qualitative research to do with cancer and cancer rehabilitation. So we've got our details at the very end of the presentation that will help you if you are interested in our services. What we do will come a bit more to light throughout today's session in terms of the employment and return to work information as well. So that's who we are. What we're going to do today is, like I said, we're going to run through those questions that were preempted as part of the workshop, but we just wanted to draw your attention to the next two slides in terms of common side effects of treatment and the impact of treatment. So we're going to kind of talk to those questions, and this information will keep kind of coming back to. As you would all be aware, there is a number of common side effects of treatment from cancer treatment and lymphoma treatment. We've listed a few up there, so you can see some of those impacting factors, and they're what we find really impact a person's ability to be able to think about returning to work or to maintain employment. So you can see up there we've got nausea, fatigue, pain, sleep issues, mental health, skin and hair issues, lymphedema, cognitive changes, neutropenia, and intimacy issues. So some of these things will impact people at quite a high level. Others will be minimal. You might have all of those just common side effects, or you might only have a few. But what we find is that most of those those effects listed on the page there really do impact people's ability to function on a day-to-day basis, and they really can culminate in enabling people to really return to work. So particularly as occupational therapists, we work with people to really see which of those side effects are impacting your personal ability. It might be different to the next person's impact. So we work really closely with people to understand which side effects of treatment or of the lymphoma itself are really impacting you on that day-to-day level, and how can we get to the bottom of those to try and assist you in that return to work and or maintaining employment. If you can see on our next slide, we talk a lot about, the physical side effects of lymphoma treatment, but a lot of people really, and we find this a lot from working with people, is that post-treatment, you may start to look like your old self and you might seem to act like your old self, but in reality, the way that you're feeling is not like your old self. And we've got that quote there from a patient that we worked with that says, just because I finished treatment doesn't mean I feel the same as before cancer. A lot of people report to us that now that I'm looking healthier and I'm looking well, people think I'm ready to go for work. I'm set to maintain or resume my employment as I used to act before, which is not the case for a lot of people for a while or permanently. So we just want to sort of highlight that, and it will be discussed later in one of the questions that was brought up. But it's really about noting that you may feel different. That's okay. There are things that we can do to assist you to get back to that place of employment, and it just might be adjusting and compensating in a few ways. But it's also about acknowledging that people will potentially expect more of you or expect what your pre-lymphoma kind of workability was. And it's about acknowledging that and bringing that to the forefront if you're comfortable to do that, because people are capable of working during and after cancer treatment. It's just that we may need to adjust some things about the workplace and some things about how you function so that we can get that better lifestyle management and the management of work and being able to return or maintain employment. So just a couple of things to keep in mind as we talk forward to the coming slides of the questions that we were sent through. Andrew, I'll hand over to you to start the questions.
Yeah, absolutely. Amy, I might get you to go back to the side effects page just before I launch into this. I think it's probably, and it'd be great if people could jump onto the chat and just give us a little bit of an idea about if they're comfortable where they are in their treatment pathway. I'm assuming we might have a mix, given lymphoma is a broad umbrella term for a lot of different 50 plus different types of cancers, and lymphomas can be highly aggressive, requiring drop everything and highly intensive treatment straight away, all the way through to indolent lymphomas, which may not need anything other than monitoring for long periods of time. And then you've got the the intermediate lymphomas in the middle. So I mean, if people are happy just to give us a little bit of an idea about where they are in their treatment or management at the moment, because I think it's really important to point out that these common side effects of cancer treatment, some of them will be more acute, that will be directly related to your systemic therapy, whether that's radiotherapy, chemotherapy, immunotherapy, stem cell transplantation, where there's a sort of like a finite period where you're going to expect these things to be impacting on your overall health. So neutropenia is a good example of that. Excuse me. For somebody having intensive chemotherapy, becoming neutropenic and then awaiting count recovery after that. But I suppose where the space where we really attend to when working with people around the topic of employment and cancer is these side effects that might start out to be acute but might turn out to be more chronic. And those are the a lot of those ones up at the top. So sleep issues, pain, chronic pain, cognitive changes, so your memory, your ability to process things, your ability to adapt to change, your executive functioning, that higher level functioning of your brain, and also cancer-related fatigue, which is by far and away the most common side effect of all cancer treatment. And along with those cognitive changes are really two key issues for people either maintaining employment or getting back to work, and staying at work for longer periods of time after their treatment. So I think I just wanted to point that out quite overtly in this slide. I think the other one which Amy sort of alluded to is if we think about sort of above the shoulders and below the shoulders, so above the shoulders, the significant impact on a person's mental health as a consequence of any cancer diagnosis, but particularly complex blood cancers like lymphomas is a really significant piece to address as well. So we'll go through some of the literature and what some of the clinical literature has indicated gives you the best chance of maintaining employment and getting back to work after your treatment. So this was one of the I suppose the obvious questions, to work or not to work, what to consider, and this is something that comes up. It's come up quite a lot in a lot of the roles that I've done over the last 10 years. That that initial shock of getting diagnosed for somebody who's of working age, and then do I continue to work? Do I not work? Do I reduce my hours? How do I go about making all of these decisions? And I think also to point out that obviously everybody's individual situation is going to be different. So we're going to be able to give some generic sort of advice around things to consider and around resources which you might be able to access, but there's no one size fits all when it comes to advice around this. So obviously one of the most important considerations is what type of lymphoma have you been diagnosed with? Is it an aggressive type of lymphoma, like a diffuse large B-cell lymphoma that might mean that you need treatment pretty much straight away, and your treatment's going to involve some intense chemotherapy, often most of the time in an acute hospital environment. And if you're a person that's a builder, a contractor, a labourer, then that's obviously something where you're not going to be able to work if you are having to be in hospital for your treatment. For people where they're doing sort of more desktop work, where they can essentially work from anywhere with an internet connection and a laptop, that question then becomes a little bit more trickier as to whether they're going to be able to manage certain amounts of their role whilst having treatment. So the first point of call is always going to be your specialist, your medical specialist, your haematologist. In saying that for anyone who's having intensive treatment, that advice from your haematologist is going to be paramount. Like, you've got this type of lymphoma, you're having this type of treatment regimen. Here's the likely side effects. You're likely going to spend this much time in hospital. Therefore, I think, potentially it's better off to have a period away from work, and then we can review and reassess that as we go. A little bit trickier for other types of lymphoma, where you might be having your treatment as an outpatient, or you might be just on oral medication. So there might be a bit of a period of time when you're initially diagnosed, and the shock of that diagnosis is right at the fore, where that you might need a little bit of time to step back and process what's happening to you as a whole, as an individual, and as a partner, or as a family group as well. So medical clearance from your haematologist around work is really, really important. Considering the type of lymphoma you have in your treatment. Touch on this, the feasibility of the role and the tasks that you do. And a lot of people will be, have a lot of, it'll be very intuitive as to whether it's going to be black and white. No, I can't go back to work whilst I'm having this type of treatment, because the logistics are just not going to work. But But for others, where both your lymphoma factors and your treatment factors, plus your individual factors and your individual role factors, may be able to be adjusted to help you maintain work. So in this sort of situation, if I'm providing information and support to somebody at this sort of early stage, and that question does come up and comes up sort of regularly, it's always a very individual discussion. So even if you are in a situation where you can work, you've got a great employer, you've got a great line manager, you can work from home at a desk, and your treatment regimen may allow for you to do that, you may not want to work, and that's okay as well. And I think it's really making sure that you make that decision consciously, and you get the support that you need to be able to follow through with that decision, whatever is the best decision for you. I mean, we've also got to be honest. A lot of people don't have the luxury of having any time off as well. So some people just simply must continue to work, and that's a cold hard reality of the world that we live in today. So we don't want to sugarcoat sort of any of that as well. That is a reality for a lot of people, and it's certainly something that we're constantly working with in our client group around. I have to work, and how can I just get through to the end of my treatment regime as intact as humanly possible.
Yeah, I'll just add to that, Andrew. It's also about being really open and honest with your treatment team and with yourself, and really addressing pretty much everything that Andrew sort of just said, but thinking about what are your priorities if you have that luxury, but also, in reality, what how are those physical things and those emotional and the cognitive things really impacting you, and really being honest about that impact will really help in that decision as to whether or not to consider maintaining or returning to work, obviously with all those other factors Andrew's mentioned as well. But being really honest with yourself and thinking about how do they impact me on a day-to-day basis, and the family and your work situation.
Yeah, it's a good question in the chat. What counts as intensive treatment? So, in general, I would say, and this is not a black and white answer, but in general, if your treatment is requiring you to be in an acute hospital bed, so admitted to a ward, then I would definitely say that's intensive treatment. But also people can have pretty intensive treatment as an outpatient now. There'll be people on the session today that have had, pretty intensive treatment regimes as an outpatient in day oncology treatment centres as well, where all of those medical complications of a reduced immune system, infections, anemia, fatigue, and other medical complications are paramount as well. So that's how I would answer that question. If you're having really, really intense treatment that has really immediate medical consequences, and that's why your hematologist, but also your lymphoma nurses are your best first port of call in that situation. What does this treatment actually look like? I know I'm getting R-CHOP, but what does R-CHOP mean? I know I'm getting rice. What does rice mean? So yeah, great question.
Okay, so just moving on to our next question that was asked, are there any organisations that help people with cancer find employment? So there are a couple of different sort of organisations or people that can assist, and we've listed some of them there for you. Again, it depends on your personal situation, so we're giving you some of that information. You will always need to potentially speak to a professional that will be able to give you some more advice. But you can see there we've got the Disability Employment Services. So that is one of the categories. Andrew, I might get you to add to that one. I know you've worked a bit more in sort of that space. If you want to add in now, it might be the best time.
Which one? Sorry, the
DES. Did you want to add anything to that?
Yeah, I mean, we were talking about this before we started the session, and I think again in the spirit of not sugarcoating things, there is a lack of consistent and systemic support for people around employment and cancer as a whole. And if you think about it, if anyone on the call knows somebody that's been of working age and had an accident, like a car accident or a motorbike accident, there's an entire insurance and medical system called the TAC, Transport Accident Commission, that is designed and has all of the appropriate infrastructure, procedures, programs, and health professionals to get you back to your employment after your accident. But no such thing really exists for cancer in Australia, unfortunately. There are some countries around the world, particularly the Scandinavian countries, that have legislated employers to get people back to work after cancer. But in Australia and in most other countries, to be honest, there is a lack of coordinated systemic support for people in this space. So we've just listed some of the things here that people sometimes can have access to. So the normal employment services for anyone on Centrelink benefits, the job active sort of services. There's DARES, Disability Employment Services. If somebody does get approved for a disability pension, that's similar to the employment services, but slightly different. There's life insurance. So for people of working age that have a super policy, one of the things that in providing information and support to people at diagnosis in previous roles, if somebody was of working age, it's almost one of the first things I would ask them is, do you have a life insurance policy? And lots of people have them and don't realise they have them. They sit within your superannuation fund. If you're not sure what you have or what your partner has, or what you can. Often super funds have advisors where you can go and sit down and or call and ask about what your policy sort of is. But it's we often get people that are 2 years down the track after their diagnosis and treatment and haven't realised that they can be claiming a life insurance policy, which might not solve all of their. It's not necessarily a panacea, but it can give people access to occupational rehab specialists to help you get back to work after that period of treatment.
I think Andrew, that's a really important point to make. There are huge numbers of people that don't realise in their super lies some of that insurance. Some people also have that as their own additional insurance as well. I think it's useful to note as well.
Yeah, and always good to obviously get advice from your financial planner, lawyer as well, and there are legal firms that offer sort of one-off consultations for free sort of in this space as well. And the last one, if you're in a large business, often an employer, if you work with particularly via your HR team, might have an occupational rehab specialist provider that they contract that is contracted to that large business to help you get back to work after your cancer diagnosis. Much less likely if you're in a small business, and again, not to sugarcoat, majority of Australians are employed in small businesses still in this day. So that's a little bit about how to find assistance to help people maintain and get back to work after their cancer experience.
Yeah. And another question that we had was, what are the expectations to have of yourself for navigating returning to work or maintaining employment after treatment? And I'd say also during treatment as well, because we know people obviously can return to work during treatment as well. Like everything that we've already said and will continue to sort of say throughout the session, is that this is going to be different for everybody. We've already alluded to, people have multiple treatment side effects that are different to other people, different impact of the actual lymphoma itself, but very much different life situations as well. So whether it's it's your family situation, your life, the activities that you enjoy, that you actually partake in, what your requirements on your everyday life are. And also that the actual role that you're required to do. Everyone has a very, very different situation, and that's going to be really impactful on what your so-called expectations are in terms of returning to work. So the idea is to really consider what your personal factors are, what's your financial situation, what are the requirements in terms of what you need to be able to pay for during and post treatment, and what are the actual factors specific to your own cancer. We find that it's also really linked to the part of recovery that you're actually in, as to what the expectations you can kind of have on yourself. We really talk about setback planning as well. So enabling people to identify that whilst you might have expectations and you might have a set plan on what you think that you're going to, how long you might take to return to work, or what are the challenges that you might sort of face in returning to work, you're also going to have setbacks as well, and things that are a bit unexpected. So whilst you will have those expectations, it's really, we often talk to people about the need to be flexible and the need to be kind to yourself, because there will be things that are out of your control. You can kind of anticipate some of those impactful factors from the earlier slide that we spoke about in terms of some of those side effects, and how will your fatigue impact you, and how will your cognitive abilities potentially impact your role. But some of those things we don't really anticipate. So really being kind to yourself and noting that there are going to be some things that will come up that potentially you mightn't have expected, or you mightn't have really taken into consideration when you're returning to work. So lots of different things in terms of the stage of cancer that you're at, or the stage of the lymphoma, in terms of if you've finished treatment, or if you're in ongoing treatment or post treatment. Lots of factors that you need to kind of consider. So yes, there are expectations in terms of where are you in that treatment stage, or where are you in the recovery phase, that you can kind of predict. But really, we really find that because everybody's individual, how people react to treatment, how people, what their expectations and what their sort of life requirements are, really are individual. So it's kind of one of those answers that we can sort of see a little bit of a trajectory for, but really impactful in terms of really thinking about your own individual situation. Andrew, do you want to add anything?
Yeah, I think for me, this question, this is a great question. One of the most complex things working in this space, one of the most complex things for people, if you move all of the stuff that you've just articulated, Amy, if you move that to one side, there sort of is a real fundamental question for each individual person. And is it do you want to get back to work? So if you move all the other stuff to the side about the financial, the stage of your life factors, if a cancer diagnosis, any type of cancer diagnosis, can be a real spanner in the works of your life, but it can also be a real impetus for change as well. So sometimes people take that opportunity that may have just been cruising in their job, or been sort of happy but not really happy, sort of fulfilled but not really fulfilled. And sometimes a cancer diagnosis can sort of be the straw that breaks that camel's back around. No, I don't want to do, I was on this career path, career trajectory, but I don't want to do that anymore. And that's that's something that is that can be really, really challenging in a time for people that there's lots and lots and lots of change, lots of upheaval, and lots of new life circumstances to adjust to. So I just wanted to sort of acknowledge that as well.
Yeah,
really, really important.
Yeah, absolutely. So we've also been asked the question, or the statement, I'm very anxious about going back to work and not coping. Do I ask to start on reduced hours, or just try to go back to full-time straight away? So again, really dependent on your individual situation and on your actual lymphoma, and also the treatment and the side effects. But I guess as a first port, and also where you are in that treatment phase as well. But the first port of call would be speaking with management or HR and the relevant people at your workplace about a graded or graduated return to work plan. So again, and we're going to talk about how you access and who can assist in a later question, who can help you with a graded return to work plan. But the idea is really having a look at that role and thinking, how can I adjust that to suit what I'm going through now and what I'll potentially be going through over the coming time, and how can we actually work that role to sort of benefit our abilities. So, you know, you might be working and being impacted by fatigue or the cognitive issues that we spoke about earlier. So how do we adjust those roles? And it really is about being as open and honest as you can or as you want to be with your workplace, and finding that person generally within HR or management that can assist you and who really knows your role and can see what you need to do and how you can potentially adjust that role based on what you're actually going through, whether it's fatigue or executive functioning issues, or whether it's access to getting to work as well, which is quite a practical issue that a lot of people face. So starting off on smaller roles within your job. So it's really about looking at that role and seeing how can we do what we as OTs call a task analysis of the role, and how can we break it down in order to potentially return to work doing smaller roles. So changing what we do in terms of the actual task. It's also about building capacity. And so we may not start, you know, full-time straight away. We're talking about that graded return to work and what does it look like for each person. So working with someone like an OT or your workplace to find out what that general baseline and that capacity is. And then if going well, as you begin to return to work, looking at increasing that over generally a fortnight. So allowing your body to get used to that return pace for around about 2 weeks, and generally increasing that 10 to 15% per fortnight. So looking at increasing to what your hours were before, if possible. Again, that doesn't have to be the end goal, but if it is looking at full time, then would obviously increase by 10 to 15% and up to whatever hours you're working. Having regular reviews is really, really important with the workplace. Open communication is really key. Obviously, it's key for you yourself to be able to really say, this is what I'm experiencing and this is how it's impacting the role that I'm actually attempting to do. But it's also really key for the workplace so that they don't ask too much of you, or that they don't ask too little of you, and so that they can kind of see where they're heading in terms of treating you well, and having a nice open line of communication is really, really important. So you don't feel that you know, there's a barrier in that return to work as well. So we do suggest regular meetings once you have returned to work, but we also say in that prior to returning to work, trying to maintain that open communication. And it doesn't have to be formal communication. You know, popping in for a coffee, popping into one of the team meetings just to say hi is also really important in terms of maintaining communication, but also from a connection point from your point of view as well, and staying connected to that workplace so that you can actually decrease some of those anxieties that are mentioned in that question there of returning to a workplace. You know, it can be really, really daunting for people to return to work for long periods of time and for short periods of time as well. And it's not just about returning to those roles, it's also about returning to you know, a group of people who you don't know who are going to be, you know, react to you coming back, or vice versa. So we talk a lot about staying connected to workplaces for people that want to, and really talking to your HR and your management about how you want to stay connected before you start that return to work process. Again, really individual to the job you do yourself, as well as to everything in terms of impacting factors on you as to how you would return to work. But in general, it's not a straight back to work sort of situation, because we have setbacks and we have a lot of those symptoms and side effects that we spoke about earlier that will impact that return to work, particularly fatigue and cognitive strain. So generally the people that we work to, it's a graded return to work in an individual graded return to work, and it's really about being honest with yourself as to how much you can sort of cope, and then building on that.
Amy, I'll just add, I think, I always like to go back to research what the clinical literature says, and you know, this is such a common question, which has such a wide variety of answers that are dependent on a lot of different factors. One of the I suppose education pieces that I'll always do with someone working with them in this space is talk about the effect of cancer and cancer treatment on somebody's cardiovascular system, which is a there's objective measurements that you can do that researchers have been doing for about 20 years now. And I'd be interested to know for people if they want to jump on the chat, if anybody has felt like their treatment has aged them, and I use that term specifically, aged them, aged their body, aged their mind. The research that I'm talking about that's been sort of done over the last sort of 25 years, exercise oncology, first of all looked at what measurable effect does cancer and cancer treatment have on somebody's cardiovascular system. And your cardiovascular system is, your heart, your lungs, your muscles, and your tissues that take in oxygen from the atmosphere and expel carbon dioxide to give your body enough energy to function. How fit you are, how good that system is working, means the more energy you're going to have. It's intuitive. The fitter people have more energy than wildly unfit or wildly unhealthy people. So in a normal life trajectory, that the best way to measure your cardiovascular fitness is by a CPEX test, cardiopulmonary exercise test. You would have, you see people on TV and documentaries, Lance Armstrong, he's on the bike and he's got the big mask on with the tubes coming out of it. That's a CPEX test. And really it's just, all it's doing is measuring the gases that are being expelled out of your cardiovascular system, which is in turn measuring the efficiency of how well your heart, your lungs, and your tissues taking oxygen out of the atmosphere and distributing it to your body. And in a normal aging process, your cardiovascular fitness, as measured by that, peaks at around about 40, anywhere between the age of 30 and 40, depending on your lifestyle. And then after that, it goes down 10% every decade. And that's just called aging. None of us can do much about that. You can do something about it with lifestyle, but everyone's going to age. And so what this research initially first looked at, more than 25 years ago now, was, all right, if we know that your cardiovascular system ages 10% every 10 years, what does cancer and cancer treatment do to it? And what they found was that, a 3 to 6 month period of treatment can decrease your cardiovascular health and fitness, by 10%. So that's effectively saying it can age your body 10 years in the space of 3 to 6 months. And often when I talk to people about this, they sort of go, wow, that sort of validates how I've been feeling. I feel like this treatment has aged me, both my body and my, above the shoulders and below the shoulders. So that was the early stages of that research, which was really, really definitive. And they've done more research in that space, particularly for blood cancers and particularly for people having stem cell transplantation as well. And the drop can be even more marked. It can be, up to 20, 30% for somebody having a stem cell transplant for blood cancer. Now that research sounds all doom and gloom, but what it led to was the exercise, the physical activity and exercise revolution, where, 25 years, when I first started, we would still say to people, rest and relax and don't do anything while you're having treatment, but we don't do that anymore. We want people to be as active as possible within reason. You don't want to do too much, but you don't want to do not enough. And what that research found was you can mitigate that drop. You can stop that drop from being so bad, so significant. And then you can also reverse that drop, again, depending on a number of different factors, your age, the type of treatment you're having, the type of cancer that you have as well. So why I'm sort of outlining this in this question is I'll often say to people, you can do an objective sort of measurement of your cardiovascular fitness, and then you can derive from that your energy levels, and then you can continue to map that over the course of 3, 6, 9, 12 months, just to see how you're going, how you're tracking from a rehabilitation perspective, and also how that then fits into getting back to work. So as an example of this, I would, if somebody has been diagnosed with, I'll use the DLBCL example, one of the most common forms of lymphoma. If you've had highly intensive treatment, 4 to 6 rounds of intense chemotherapy in a hospital, followed potentially by a stem cell transplant, an autologous stem cell transplant, and that's been done over the course of 6 or 8 or 9 months. For somebody who's gone through that amount of treatment, I would be almost always leaning to you're going to need a graded return to work. Going back to work full time is probably not going to be feasible for you. What that looks like, again, that's going to be up to each sort of individual. So a really, really great question. Again, if it's something that you think you're struggling with, I'd encourage people to reach out and seek some expertise in this space as well.
Yeah, and it's about, like we sort of alluded to, is being realistic and honest with yourself, but sometimes that does kind of need that adjustment and that help from a professional who'll sort of point out some of those things that perhaps you're not aware of, or perhaps you're not wanting to sort of recognize, which will be really impactful, and that really can impact that ability to return to work and stay at work, and also your self-esteem and your emotional well-being. So that planning for setbacks is far better than getting to the setbacks, and not having a plan really impacts you from a multitude of different reasons, not just that I can't go to work. It's really about your emotional well-being as well, and mental health. So really key. So we were asked, where can I get information on dealing with the risk factors and returning to work? So the risk factors we've sort of alluded to right throughout the presentation, and we spoke about some of those earlier. Obviously, your first port of call would be Lymphoma Australia nurses. Wealth of knowledge on those risk factors and some of that information that can really impact you. We've also popped down the Cancer Council, the Macmillan Cancer Support website, which is an excellent resource, and cancer-specific websites and organisations. They will give you some of that more generic health information. So really generic information in terms of what are some of those risk factors, how will they impact you on a day-to-day basis. They'll give you some information also about some peer support groups and some other education and evidence base as well. If you are looking for something that's a little bit more individualized, then that's where accessing other health professionals is really important. So occupational therapists, obviously that's a space that we work in. We're very at the whole purpose of an OT is to look at your individual situation and tailor your rehab plan or your return to work or employment plan, and really looking at those individual factors. What's your family life, what's your mental health situation, what's your cognitive ability, and what's your fatigue, etc. So obviously, occupational therapists are quite key in that, and multidisciplinary team is extremely key in that factor as well. And research really shows that people's success and dealing with the risk factors, but also the impacting factors on that return to work, are really beneficial and proven if you can get a multidisciplinary team sort of behind you, which would often involve an OT, but often a psychologist, sometimes a physiotherapist, and exercise physiologist as well. And there are obviously other MDT, multidisciplinary team members that can assist in that. At Selsus, that's obviously something that we do. Andrew and I work individually with people to look at their situations and see what it is exactly that impacts their ability to return or maintain employment. So there's a wealth of knowledge out there. Some is generic information, which again is really helpful, gets you kind of aware of some of those things that will impact that return to work. That next step is getting that individualized and tailored assistance that will really help you with your own personal situation. Again, some of those things that we spoke about earlier in terms of if you have a life insurance policy or through your super or through your employer, you have access to an occupational rehabilitation specialist. They can also assist in case management, and they'll help you to get some more individualized and tailored assistance as well.
I'll just add in, Amy, I think also, there's some really specific considerations around risk factors in blood cancers. We're in the middle of the, immunotherapy revolution around the world, which is wonderful. including things like CAR T-cell therapy, which have really specific subsets of risk factors, which really are something that your specialist needs to advise you on. There's other, I suppose, other factors that people might be thinking about as well as post-stem cell transplantation risk factors as well around reduced immunity or graft versus chronic or acute graft versus host disease. And these are questions which your specialist will be able to answer pretty categorically for you and your role. Where it might be a little bit more difficult for them to answer is where you're getting into more of those chronic risk factors around your mental health and well-being, your energy levels and your fatigue, your cognitive functioning and cancer-related cognitive impairment. That's where it's a little bit trickier for a hematologist to give direct advice on those. They're able to give much more clearer advice on those things like your immunity, your immune system, and how it might pertain to your role. And obviously also the Lymphoma Australian Nurses is a wonderful resource for people with lymphoma all around the country as well.
And I think it's really key to note that asking the questions is really vital. So you mightn't know exactly who to ask those questions of, but just voicing and asking whether you're in touch with the Lymphoma Australia Nurses or your hematologist, asking those questions, and hopefully they'll be able to send you in the right direction if it isn't something that they can answer or something that they can provide information on as well. So important not to be concerned or afraid to ask those questions, and because there is a decent network out there that will point you in the right direction to additional information if they can't answer it. So will I have to consider a career change because of my lymphoma and after having treatment? Again, really individual. We've said before and earlier, sort of reiterated some of this information, that it's really important to acknowledge that you can continue to work during treatment and after a treatment. Again, this is something that's really individual. Andrew will give you a really good example in a moment of somebody that he's worked with who considered, after many years looking at changing career. But it's something, again, that's really individual. Andrew alluded earlier that it can be a bit of an impetus to change. Some people don't have that legacy, that ability to have that impetus to change either. So again, something that's really individual. Looking at your career path, looking at the roles that you have to undertake is really important, and really aligning it with what we think you'll be able to do in terms of, the impact of the treatment and in the impact of the lymphoma itself. It's sort of something that's taken into consideration when you're looking at that, whether you want to have a career change or need to. But it really is it's a harder one to answer because it is more individual. Andrew, do you want to have a chat through the nurse that you worked with at this slide?
Yeah, I'll give a couple of try and give a couple of quick examples. One that springs to mind sort of recently was a person who was working as a nurse, and so a registered nurse on a really busy, complex psychiatric ward. So a lot of time on their feet, a lot of mental energy around medication management, case management, risk management of self-harm and suicidal behaviour of patients. So really complex job. Working, a normal full-time role as a nurse, but obviously lots of overtime. Diagnosed with double hit lymphoma. 9 months of really aggressive treatment, followed by a autologous stem cell transplant, followed by some immunotherapy, and she, all up, sort of had a 1.5 years worth of treatment, and she just knew in herself that she wasn't going to be able to get back to full-time work in that specific role. So she made the conscious decision to do some extra study and go back and change her role, not to something wildly different, but she ended up doing nurse education. So she'd become a nurse educator. So instead of having all of that complexity face-to-face with patients, her role changed, where she was still utilising all of her skills and knowledge of her 30-year career, but she moved into a part-time nursing education role where she was, she was guiding and educating the younger generation of graduate nurses coming through. So it was a really good example of she knew she couldn't go back to that, but she didn't go and do something wildly different that was going to cause just too much change and too much disruption in her life. But she had a good outcome as well. Another example, a young gent I worked with. This was pre-pandemic, who had an aggressive form of lymphoma and ended up having an allogeneic stem cell transplant, which is a donor stem cell transplant. One of the complications being graft versus host disease, and he unfortunately developed a chronic graft versus host disease of his skin. Particularly affected his skin, so he was not able to. That was one where it was very categoric that he wasn't going to be able to go back to work as a builder because he was out in the sun all day, every day, and that just, his hematologist, his transplant specialist was very clear. You're just not going to be able to do that. It's just out of the question. So he went back and retrained, doing OH&S. So he was still in the same industry. But he'd changed to do a role where it was nowhere near as physically demanding, but more importantly, he wasn't going to be out in the sun all day, every day, aggravating his chronic graft versus host disease. So just a couple of examples. They're sort of more extreme examples, but again, every situation is going to be different for every person.
Yeah, and they're good examples to sort of highlight that, thinking outside of the box is sometimes the way to go if you are still obviously interested in that career, but you've got limitations. So there's a couple of ways, that professionals will help you to look at different things that you can actually alter in your workplace if you have the opportunity. Obviously, not everybody has the opportunity as well, which is worth kind of highlighting as well.
Yeah.
Okay, I think this is our last question. What time frame can I reasonably say I will be able to return to work? So again, like we said throughout the whole time, is that it's really dependent on a lot of different factors. Energy levels are highly impactful. The type of role that you want to do or are currently doing is really, really impactful as well. So a couple of those examples that we've given, you can sort of see that's really impactful. In terms of cognitive levels, so your executive functioning, your abilities, but also the level of confidence that you have will really impact in terms of the time frame. So some people will continue to have that rehabilitation in, services in place throughout their return to work, but also long term as well. Assistance can also be available as well. The availability of assistance, that obviously means from a healthcare perspective, but it also means in terms of your workplace as well. So are they set up to initially assist you in return to work and in helping you to do that graded return to work? So how the workplace is set up is really important. How much they will facilitate and assist you as well really does impact that time frame. So there's no set time frame. These things will definitely impact you. The management approach and sort of your HR at work is really impactful as well, and sometimes they will be a little bit more cautious in terms of helping you to return to work in terms of the amount of hours per day as well. The size of the workplace really impactful as well. Smaller businesses are often not as equipped to kind of take lengthier timeframes in terms of return to work. Again, obviously it depends on the employer and the type of role that you're doing, but sometimes that the hard and fast kind of thing that can occur is that it can be pretty impactful if it's a small business. So sometimes they will have to look at alternatives. In terms of the skill set that's required and if it will need to be altered, really important to see whether that's during treatment or post-treatment, in terms of can I get back to some of those desk jobs or those outside jobs in terms of time frames. So there's lots of things that really are impactful. And again, it's, how long is a piece of string? And I know that can be really frustrating. However, it really is the answer. Depends on your workplace. It depends on your ability to return, but really impactful is the role that you're doing. So, you know, can you return after a few months, or will it take a little bit longer if you're doing quite a job that really is dependent in terms of executive functioning, or is it longer work days that you're trying to get back to? So once again, I know that's quite, you know, it is a little bit frustrating when we're talking. It's very independent on the dependent on the person and the role, but that is also a benefit because you can work with a health professional who can really assist you to alter that role to be able to get you to a time frame that is more realistic and something that you're not pushing yourself towards, and then getting further setbacks, or taking you know, that little bit longer to get back to that role, and that can be frustrating for employers as well.
Amy, I'll be a bit more daring and be a bit more answer the question a bit more literally, because I think this is such a common question, and it is something that I think as a system we do very poorly. Like if you think about the enormous amount of resources and expertise and research that goes into, you've just been diagnosed and you need to start. If you think about all of the cogs that have to turn, all of the screening tests that you need, blood tests, fish tests, PET scan, like all of that machinery goes into seamless action. You know, you turn up for your treatment when you're meant to turn up, and all of that. There's so much stuff happening in the background, and that continues all the way through to the end of your treatment. But we do a really poor job at guiding people and giving them any sort of indication of what a reasonable time frame might look like. So what I will often say to people as a generalization around their treatment, if I use the example of the nurse that I mentioned before, if she was diagnosed and started her treatment, say on January 1st, 2022, and she finished all of that treatment around about halfway through the year 2023, so 18 months worth of treatment, I would then sort of wait for those acute symptoms to dissipate, and that can sometimes take up to 3 months depending on the type of treatment that you had, those really acute medical side effects from your treatment. I would say to people, if you wanted to get back to work sort of full time, that is a broad measurement, that time frame. Flip it on the other side and give yourself enough time to do your rehabilitation properly, to get your cardiovascular fitness as best as it can be, before you rush straight back into work. Again, for some people, they're not going to have a choice, and I absolutely understand that. But if you do have a choice, say your treatment between the start of your treatment and the end of your treatment and the follow-up of your side effects is 12 months, allow yourself 12 months to get back to work. Don't try and, you know, just get back to work as soon as humanly possible because you think that's the best thing to do. Allow yourself at the top end of the range, that full 12 months to get back to work. Again, there's lots of different factors, and I would never give somebody a general number, but as a guiding tool, that's what I would advise people.
And that incorporates that graded return to work as well.
Correct.
So,
yeah, correct.
So it's not just in 12 months, we're going to go full time. Yeah, you don't start in that 12 months. You sort of grade yourself throughout that time, and that takes that communication with your employer. And like Andrew said, being really realistic as to what those time commitments in terms of your treatment regime are, and looking at your role and thinking, how can we gradually and grade that return to work, sort of over those 12 months with that aim, like Andrew said, sort of realistically looking at it at that end of the 12 months. but yeah, it really does depend, doesn't it, on that the role that you're doing, the treatment side effects, and also the workplace and how supportive they are. So, you know, we can say all of these things that ideally this would be how it works, but you've really got to work with your employer and get that support. And there's a lots of different alternatives that we see working with people as to what that support will look like for different employers as well. So, you know, voicing what you need is really key in getting different options to help you to get to where Andrew was talking about as well.
Yeah, absolutely.
And I did lie, there is another question, and we're just conscious of time, so we'll have a look through this one. So it is, I've just got the, move that across so I can actually read. I can't concentrate as well as I could before treatment. Is there anything I can do to help this? So cognitive issues, cancer-related cognitive impairment is really common, and it's poorly understood. There is research around it, but it's really about reporting what the issues are. So a lot of the most reported cognitive problems in terms of the evidence base that people report are things like memory issues, so short and long-term issues, impaired processing speed, attention issues, and also having those three things and other cognitive issues really impacted by the cancer-related fatigue and the psychological distress or stress that comes with the cancer and its treatment really impact a person's clarity in thinking and their ability to process and to reason as well. So there's a lot of research around cancer-related cognitive impairment, and there's a lot of distress around it for people because obviously, you know, that everyday functioning to return to work, cognitive processes are required, whether it's a physical job or a desk job that requires higher level of thinking. You are using your cognitive skills to be able to, you know, even get up in the morning and start getting that process going to get to work and then to do the work itself. So what we sort of have a look at in that space, there are things that we can do to help, and a lot of that will be either adaptive strategies initially and then if needed compensatory strategies. So looking at how can we assist people to continue on and to kind of change their way that they process and change the way that they actually remember things or attend to the tasks at hand. So there's a couple of things, and we've just listed a couple of things down below, but we actually obviously look at what the role is and what the job is that you're required to do, and then we would have a look at what are some of those more specific things for you yourself and your role as to what we can do. So some of those adaptive strategies initially can be things like writing lists or popping reminders in your phone and setting alarms in order to compensate some of those memory issues that people have. It's a lot about organisation and restructuring routines and habits that OTs particularly would look at to enable you to rely less on you know, some of those memory processing issues, memory and processing skills that you might be having issues with. Working on your fatigue and getting a baseline and really having a look at that fatigue is really key, because fatigue heavily impacts a person's ability to process and their ability to remember and to attend as well to things that they need to attend to in their role. So looking at not only some of those sort of initial adaptive strategies, but thinking about what are the roles that I need to do in my job, doing a bit of a task analysis, which an OT again will have is quite specialised in doing, and having a look at, you know, can we extend the time that you're doing some of these jobs and these tasks? Do we have to do things in confined spaces, confined time frames? Looking at lighter duties, so really about adjusting the roles and adjusting the tasks for, you know, that mightn't be forever, that might just be for a shorter period of time, and it might be part of that graded return to work that we spoke about over that 12-month period as well. So looking at things that are external to what we think are, you know, the memory and the processing issues actually really contribute to fixing and to kind of getting you to better handle some of those cognitive impairments that come to light. It's a really, really common thing that we deal with, and it's a really common thing that people report. So really looking at adjusting the task and adjusting the role to then support some of those cognitive issues is where we start.
I think, Amy, it's pertinent to, and we'll send through some fact sheets that are readily available, some Cancer Council ones on cancer and employment. But I think one of the things that you'll hear is the term reasonable adjustments. So legally, an employer has to provide reasonable adjustments to help you get back to work successfully, to help you maintain work successfully. But that is it's open to obviously reasonable adjustments is open to interpretation. So that's where, again, it's really important to have expertise in your corner if you are worried about how you're going to get back to work, if you are concerned about how you're going to manage, if you're concerned about how you're managing during your treatment, if you still are working. So I think a really important point to make. The reasonable adjustments is a legal protection, but it is open to interpretation from job to job, person to person, business to business.
And that's a good point, is having the correct or the right multidisciplinary team in your corner. They obviously have that expertise and they'll be able to advocate for you with your employer as well, and obviously educate you and them as well to what that reasonable adjustment is. So that's really key. Oh, I've got another one. I keep thinking it's my last question, sorry. So do I have to tell potential current new employers about my lymphoma? There isn't a law that requires anybody to tell your employer, or for you to tell your employer. However, it's due to the impact of what that the lymphoma can have on you physically, emotionally, very key emotionally, and socially. Your impact, and I'm sure most of you are aware, it can be quite great on your daily life and also on your work capacity and that ability to return to work or maintain employment. So whilst there isn't a law that really requires you to, it's obviously advisable, because then you can have a look at those reasonable adjustments and you can have a look at, how can I adjust this in order to be able to return as best I can, and so that I've got that open line of communication and I'm not stressed and adding sort of further distress to myself. So it is your choice, very individual choice, but it could be in your best interest in order to be able to gain that support that could be really needed.
That is a really good, it's a particularly pertinent question for lymphoma as well, and CLL in particular as well, because I think the research, they've done research in this space, and it's only about, I think it was between 3 and 5% of people opt not to inform their employer about their cancer diagnosis. So most people do. Most people won't have a choice because of the disruption to their job and their role with having to manage treatment. But certain types of lymphomas, or indolent lymphomas, which are on watch and wait, active surveillance, there is that option to not tell your employer. And I have worked with people that have opted to do that, and that is again an individual choice.
Okay, so I need to take more regular breaks at work due to fatigue after my treatment. I feel anxious that my colleagues think I'm just being lazy because I don't look sick. How best can I communicate this? So that takes us back to that early slide with that quote from one of our clients. About, I look normal, but I'm heavily impacted. And fatigue is one of the most common impacting factors that are reported by people living with lymphoma and also with cancer. Very, very common thing that we receive, questions about, and that we work with people. So, key is upskilling employers and managers about about cancer-related fatigue. It's very, very impactful, and it can, like we said earlier, it can impact your cognitive ability. It can impact your ability to attend to tasks, to even attend the workplace and attend your roles. So a key thing is education in terms of yourself, but also in terms of your managers and the people that at your workplace. Andrew and I will pop up in the chat afterwards a YouTube clip that's really useful. We use it a lot with our patients, but we also get them to show their family, their friends, and also their employers. And it's a really good clip explaining cancer-related fatigue and the impact that it will have. So we'll pop that up as a really good resource for you guys. Also, obviously, some of those other places that we've mentioned before, so something like places like the Cancer Council, Lymphoma Australia, also should have some education and some sort of forms and some information for you in terms of resources. So really good resources to sort of get your hands on in terms of educating yourself, but also educating others. If you can, and again, like we said, it's up to you, if you can inform your co-workers of what you're going through and the impact, it will go a long way. Again, each person's individual as to how much they want to inform. But if people are aware, generally we find people are a little bit more accommodating and they're willing to sort of work with you rather than, just being expected to know what you're going through. Because like you say, I mean, like it said in this question, is that if you don't look sick, people will just assume that you can go straight back to what the role is. So again, like we keep sort of saying, careful consideration for each case, but really key is communication, and that will be the main, your best tool that you can have. And again, working with a multidisciplinary team, they can be an advocate for you should you need. So it doesn't always have to be on you. We, as part of the work that we do, we will often work with our patients and do some education sessions for their place of employment, and sort of educating the managers as to what cancer and what lymphoma can look like in terms of impacting factors such as your fatigue and your cognitive issues on the workplace and the role. And we found that's really quite surprising what people don't realise that they don't know in terms of that impacting factor for return to work. Okay, we might have covered some of that. Andrew, is there anything you want to add to that, this slide here?
I think we've covered a little bit of it, but I do think, it's one thing that I'm often stressing to people is if your circumstances allow and you've decided, to not work during your treatment and for the period after your treatment's finished, take the time to invest in your rehabilitation. Sometimes I describe it like if your body was a car, represented as a car before your cancer diagnosis, and there's a station wagon, it was a V8 engine, it had 100 litres of petrol that you could drive around with, and you could do all the things you need to do, get up hills with a big engine, bloody blah, blah, blah. And then you come out, you get spat out the other end of your treatment, and instead of that car, you've got a little Daewoo Shibiro 4-cylinder car with, only 2 doors and 40 litres of petrol to be able to spend during your day, during your week, during your month. So take that time to rehabilitate as best as you possibly can. Really, really vitally important. The research says that you can reverse that decrease in your cardiovascular fitness through targeted and prescribed physical activity. Really, really vitally important. I think the other one probably to mention here we haven't spoken about is peer support. I know Lymphoma Australia has online Facebook groups. Talking to someone, connecting with someone who has gone through a similar type of treatment and has attempted, and has got back to work. Really, really important to connect with your peers for peer support, because they've literally walked in very similar shoes to you. So there's plenty of options out there for peer support. And as Amy said, connection to a multidisciplinary specialist team, medical, nursing, allied health, psychology, who understand cancer, who understand your type of cancer and your type of treatment is one of the proven ways to improve your chances of maintaining and getting back to work after cancer.
Absolutely. So we've allowed a little bit of time for questions and comments. I know that they're in the chat. I will also, just whilst we're doing that, I'll just pop up this slide and I'll unshare my screen in a moment because I can't actually see the chat whilst we're doing. So I'll just pop up our contact details before we start answering some of those questions. You can see we have a info@selsus.com.au email. We obviously, if you've got any questions from today or anything about our clinical service, feel free to email us and we'll get back to you with an answer. And we also have our personal Selsus emails there, and myself and Andrew. Our website is also on there, so you can have a look at the website, have a look at some of the other things that we do in terms of our services. And we're also on all of the social media pages as well, and we often put up some education sessions on there that we run and some additional information. So I'll leave that up just for a moment, and then I'll unshare my screen so we can answer some of those questions and have a look at the chat.
Amy, if you'd like to leave it up, I can ask the questions for you if you like, and then people have some time to write down those details. I guess before I address the ones in the Q&A, I'd just like to ask, how do people living with lymphoma, how do they go about starting a return to work plan? What's kind of the first step? Who's the first people they contact, or how do they get the ball rolling?
Yeah, great question. So I would answer that sort of in a couple of ways. If an individual feels like they're not wildly concerned about getting back to work, but they do think that they want to do that graded return to work, and they feel like they can manage that process themselves, I would encourage them to do that. And so the first point of call would be, clearance from your hematologist, from your specialist. Contact with your HR person if you've got HR as part of your employment. If not, whoever your line manager is, like starting that conversation as early as humanly possible. So that's if you're feeling confident enough that you can manage that process okay. You feel like you've coped with the treatment pretty well, above the shoulders, below the shoulders. For those who might not fall into that category, I would definitely look at utilising an allied health professional like an OT to help you on that journey. An occupational rehab provider, if you've got income protection or life insurance, you'll be able to speak to them, and they might be able to provide you with a professional free of charge. If you're in a large workplace, the HR function might have a subcontracted OC rehab provider that can help you with that. If you don't have any of those things, an allied health professional like a group like us, that's our sort of bread and butter.
Yeah. And people can go to their GP and access the chronic disease management plan, so you can access multiple allied health services at a subsidised rate as well. So if you go to your GP, you can access the chronic disease management plan, which is great. So I'll ask some of the questions from the chat box. A lot of them are comments that you can read there, but one question is, what is the name of the research about the cardiovascular aging research? Can you share the link in the follow-up, please? So I can send out an email with all of the information links to the list of attendees. So Andrew and Amy can send that through to me, and then I'll send it all out to you in an email. A question from Robin and Jeff. Hi, I've been told that I have to be cleared by my work doctor's education department before I go back to work. Is this normal?
The short answer is yes. An employer can ask for medical clearance before you come back to work. Again, we'll send through some of the Cancer Council resources which go through a lot of the detail from the legal perspective. But yes, that is within the employer's right to ask for medical clearance. Absolutely.
Was that medical clearance from the treating team or from also the workplace? It was just the wording was a bit confusing.
I think it's from the treating team.
Yeah.
Yep.
So you can either get that clearance from your hematologist or your GP as well. GPs are probably much more used to doing this sort of work, paperwork in regards to employment, but that would be dependent on the type of lymphoma you've got, the type of treatment that you've had. You might want to consult your hematologist if that's feasible to do for you.
I've got a question from Joe. Are there any specific issues for people who have an indolent lymphoma and are trying to keep working whilst they're on a watch and wait period?
Yeah, great question. In my experience, the fatigue and sometimes the cognitive issues are just as prevalent for people with the indolent lymphomas. Regardless of the fact if they're not having any systemic therapy or treatment, it can, it's very well documented in the research that having a watch and wait active surveillance type cancer, you still have those chronic you can still be impacted by those chronic side effects, like those mentioned side effects that can impact your employment. Absolutely.
And also the emotional strain as well is often reported as significant.
Yeah, definitely.
We have a lot of people in our community that are on watch and wait, and anxiety is a massive
yeah, totally.
Mm.
Yeah, great question.
Massive impact on a day-to-day. Next question: Can my employer sack me while I cannot work due to treatment?
Yeah, I mean, that is a good question. Again, there'll be some details in that the info that we sent, the Cancer Council stuff that we send out, which is informed by the McCabe Centre, the McCabe Centre for Law and Cancer. All of their legal team do the written information around these topics. So there's and I'm certainly no expert in this space, but there's provisions around not attending work for 3 months in a row, or 3 months collectively for a year if you've been cleared to work, but employers can still be held liable if they were to terminate somebody who'd been away from their employment for more than 3 months. That's a complex one that I would encourage people to seek their own legal advice on.
Yeah, and it depends on the job you're going back to as well.
Yeah.
I think we've got time for one more question. So it's regarding cancer-related cognitive impairment. Can this affect driving because of the effects on attention and judgment?
Absolutely. Yep, absolutely. And there are so anything that in terms of cognitive processing, so attention, that processing speed and the memory, we use all of our cognitive all our cognitive skills with a lot of tasks that we do day to day, and driving is definitely one of those. A lot of information coming that needs to be processed quite quickly. So really impactful driving can be quite impacted. There are specialist OTs that work within driving as well that will assess, but also give some accommodations as well. So that's something else that you can sort of access, and they're in each state as well that will impact. Because again, it's not just about. It's quite an interesting one to ask, because we're obviously talking about returning to work, but a lot of people are required to drive for their workplaces as part of their role, but also getting to work, is quite. It's something we need to think about. So, do you catch the bus, or do you walk, or do you drive? And so when we're working with people in return to work, it's not just about that role itself. It is things that we would also look at, like you're driving, and like how do you prep every morning to get to work? So it's a really good point to raise, but definitely impacted. Yep.
So an example of an adjustment for somebody going back to work who might be not totally immunocompromised, but slightly immunocompromised, who might be used to getting the train into work in the CBD. So a reasonable adjustment might be that the employer allocates a car park for that person, for coming into the office 3 days a week. So they're not getting on the train with a whole bunch of coughing, people coughing all over them, and they can save a little bit of time as well,
and energy.
Energy by not having to get public transport. So these are some examples of some reasonable adjustments.
Perfect. Well, I think most of the other comments in the Q&A section are more just updating you on their where they're at the moment with their return to work. So we might end it there. I'd like to thank you so much, Amy and Andrew, for coming to talk to us and answering our community's questions about working and lymphoma. I'd just like to let everyone know as well, we have a lot of information, fact sheets about some of the side effects that do affect you returning to work, such as fatigue, cancer-related cognitive impairment, or chemo brain as it's more commonly known, side effects of sleep. So we have a lot of information on our Lymphoma Australia website in the form of fact sheets and side effect pages as well. But we've also had some previous webinars on some of these side effects too. So there's more information on our website, or you can also contact our nursing team on 1800 953 3081, Monday to Friday, 9 to 4:30 Australian Eastern Standard Time. And as Andrew and Amy mentioned, if we can't answer the questions directly, we can also always navigate you to someone who can answer the questions for you. I'd just like to mention our next Supporting Families webinar will be on supporting the partner and carer, and it will be next Tuesday the 15th at 11 a.m. Australian Eastern Standard Time. I've popped a link to our events calendar in the chat box, but I'll also put it in the follow-up email as well. So if you'd like to register for any of our upcoming webinars or support groups, you can do it through our events calendar. But I'd like to thank you so much again, Amy and Andrew, for your time today. It was a really great webinar, and as you mentioned, it's so individualized for each person, but I think you did an incredible job of covering, you know, the answers broadly, but definitely something that, you know, people have individuals circumstances that may cause barriers for them to return to work. So thank you so much for your time today, and I hope everyone enjoys their afternoon.
Thanks so much.
Thanks, everyone.
Thank you.